Welcome everybody for our new episode of Ocular Insider podcast about the dry eye. My name is Peter Baranovic and I am having this privilege to having a special guest today in nice place of Copenhagen with a beautiful view to the harbor. And please let me to introduce you my guest, Dr. Johann Krüger from Cape Town. Is a distinguished ophthalmologist in Cape Town, South Africa with over 3 decades of the experiences specialized in refractive eye surgery. He is renowned for pioneering numerous complex surgeries and have a significantly ancient vision for patients and previously without any visible solution. So you solve the problem before even that doesn't exist. That's really great. And I'm happy that you, in a moment, you are a member of the IICAA or ESRS and several other different associations. Also, you are a founder and principal surgeon at the Triggerberry Eye Center, and also you recently opened more. And I think the last one was in a harbor, which
yes, in the Cape Town waterfront.
Cape Town waterfront, which I like because a beautiful view of the harbor. And you are honorary consultant of the position of the University of Stellenbosch, and founding member of the World College of Refractive Surgery and Gift of Sight Trust in Cape Town. Nevertheless, you are a grandfather, father, and a motivated golf player. I'm sure you have a much better handicap than me. And you have a special interest in refractive cataract surgery, laser refractive surgery, cornea surgery, and ocular dry disease. So welcome you, Johann.
Thank you very much. A pleasure to be here.
So I would right away start with the interesting question. So why dry eye? What is the motivation for a distinguished surgeon like you to go to the dry eye and ocular surface?
Well, I've always had an interest in refractive surgery, cataract surgery, and particularly refractive cataract surgery, as well as laser refractive surgery, being one of the first in South Africa to use, in fact, the excimer laser. So being involved in refractive surgery, already implanting full range vision lenses in the mid-90s, and developing many techniques. One of our challenges is, with the refractive patients, is of course the refractive target.
Okay.
And if the eye is dry, first of all, you're going to miss the target and you're going to have variability in your measurements. And this we already found in our early experiences. So we used to sometimes get results that you didn't expect.
Okay.
And so back in 2016, this became sort of more to the fore. There was lots of research going on regarding to dry eye. And that's when I came to Copenhagen, to this very city, and found a wonderful dry eye technology, and the IRPL device I found here, and I took it back with me to South Africa because there was a need for me to address this dry eye problem.
I cannot more than agree. I think as I joined the industry early 1999, and as a youngest product manager from Alcon, and I see this unsatisfied patient when we launched the multifocal lenses, and everybody was a little bit shocked. And the very common sentence I heard, "Oh, it's a adaptation time."
Yes.
So you remember these days?
Yes, neuro-adaptation, Mrs. Stones.
Yes. I know. It's nice that the knowledge move forward, and also the technology also following, because otherwise we would not have a solution for treating this kind of patients. And I think that one of the key points is that also the problem before the surgery you focus, or is only the after surgery? What is your basic protocols for those
Well, we need a comprehensive evaluation before, starting with a questionnaire. And that gives you a clue to what's going on with the patient. So treatment before, often IRPL, which we've shown is patients will have less complaints afterwards.
Okay.
Treat them with IPL before. And secondly, also with the medical surface lubricating type, non-preserved type drops, etc. And also supplements sometimes that we complement. So it becomes a holistic approach to the patient. Secondly, when we evaluate patients, we can get variability in our measurements because of the dry eye. So test twice, operate once. And
the approach.
so that is a very good approach. And then, of course, intraoperatively, one also has to take care. There are many drops, etc., that you must maybe use before the surgery in terms of using preservative-free drops, and also not using the anesthetic drop for too long before the surgery because it's toxic. Some things during the surgery, like we use iodine to clean the eye, it's coming in the eye, does irritate the eye. So one would put HPMC 2% on the eye to protect. At the end of the surgery, maybe a contact lens on the eye, and afterwards also lubricate in between with non-preserved drops. So there are preoperative measures, there's intraoperative measures, and there's postoperative measures that need to be followed. And it's also advisable, if we're dealing with a patient that has a tendency to dry eye, to also do a follow-up IRPL treatment after the surgery. And in some cases, it's necessary to do maintenance treatment after 3 or 6 months.
Yes.
So this is more or less my approach to use the IRPL to improve my patient outcomes, improve my patient satisfaction.
As I just recently see your research and also your outcomes in the published clinical studies almost reaching 80-90% of the satisfaction. I believe this is what all the refractive surgeons searching for,
Exactly.
to have a satisfied patients, happy, not follow up with a lot of disturbance, and especially in cornea, which is most innovative, one of the most innovative organ, and really dependent on a quality of the tear film. Probably.
Yes, absolutely.
So what could be the error that could be created if you forgot all these things? Is there anything like significantly first one that may appear?
Well, the K readings may change, or the axial length may change. I've shown that the epithelial map changes in dry eye people, because the tear film and the epithelium is actually one. So if the eye is dry and you treat with IRPL 4 or 5 times, and then you do the map, the epithelial map, you will see it's changed, and the amount of cylinder may have changed. And I've actually shown this in studies.
Yeah. And I think that's what you see. This is the direct link between the untreated patients, their symptoms after the surgery, their comments that they are unhappy. Is it creating basically blurry vision, I guess?
Yes, blurry vision, ametropia, and just from dry eye alone, it's about 5% of complaints of dissatisfied patients with a trifocal lens, for instance, would be just because of the dry eye. But up to 60%, 65% of complaints are because of blurry vision. And that is related to the tests that were done before, and the ocular surface wasn't normal. So therefore you are getting incorrect readings. Therefore you are ending up with an ametropia or a refractive surprise. And this is directly related to the dry eye. So
how is your clinic set up? Because it's always, you'll be hearing it's very complicated to start with this kind of very base and dry eye setup. Is there any special, that you're using, or it's a basics that you believe you need to have this number of the optometrists doing that? Is there anything that you would advise?
Well, first of all, in our preoperative screening of patients that come, we can be directed to which are the tests, so we can customize the flow in the practice. With dry eye patients, we use the tear check, and with the tear check helps us to also categorize the patient and how severe he is, as well as where the problem lies. It helps us to identify the cause, and then we will direct the treatment towards the cause of the dry eye. Of course, it's very important the technicians will also sometimes see during the tests that the patient's eyes are dry, and then they will do a tear check on the patients. And the clinician, as such, will then do a very comprehensive biomicroscopical examination of the patient, identify the cause of the dry eye and what the dry eye signs are on the eye to be treated. For instance, if the patient has epithelial abnormalities, we would have to treat specifically. And so this would be our approach, and then the measurements are made. And if we see there's dry eye, we would then put the patient on a treatment regime, treat them with IPL 4 treatments. Either we have different protocols, day 1, day 14, day 45, day 75, or we can do it every 2 weeks leading up to the operation. And this actually then prepares the patient for the surgery, and then we would repeat some of the tests after the protocol.
Yeah, I think this is exactly what should be done to achieve the best outcomes from the surgeries. Seeing your presentation just recently, and I saw that you are a fan of PRP. I know that this is a really nice approach, and a lot of patients would benefit either creating their own eye drops from the blood, or now I saw also in a couple of congresses the injection. So how would you see this new approach could help improve the stages or the healing process even better?
So the patients with the epithelial abnormalities do very well with the PRP eye drops. And I think in addition to this, in future, to also inject the stem cells into the lower eyelid trough could have some cosmetic benefits as well as help for the dry eyes. And this, I like this idea of regeneration. And I think this can also be enhanced with the IPL. First do the IPL, and a couple of weeks later or a week later, we do the stem cell injections in the eyelid, and then we follow that up again 2 weeks later with another IPL. I think patients will benefit a lot from that.
Is it any like a disclosure criteria for this kind of patient? Because I personally knew the PRP because I'm the knee patient. You need to have enough water content. You need to drink water. You need to decrease your fat index. Because it's not easy to get the PRP from the blood.
Yes. I think that there's various areas, of course, to get the stem cells from bone marrow, which is a little bit invasive and painful. But there's also, particularly in the ladies, if you wanted to do a limited, or even in men, you want to do a limited liposuction, you can actually get the stem cells from the fat, and fat or lipid stem cells are actually very effective stem cells. It's better than just taking from the blood. But preparing the injection, one can do multiple spins with your centrifuge to get more concentrated the cells to inject.
So how is the group of the patient you're now following with these therapies?
Well, we are just starting now with this, and we want to do proper clinical study.
Oh, yeah. So I think that's the interesting point. I think the different modalities, different treatments, definitely because I believe because dry is multifactorial, can help us enhance the workability of different treatments, and maybe those treatments work together to get better and faster outcomes.
Yeah, certainly. I think we need to combine therapies and be proactive with this, even further improve the dry eye effectivity of either the PRP alone and the IRPL alone, and if you put them two together, I think we should get an even better result.
Great. Is it anything that you would put on top of this our nice and short discussion. I know that you need to run, and I'm happy that you join us for today and being together. How would you see your clinics in the future be able, because it's always question for me, because of the South African population, you have the huge population of the black people skin type which cannot be treated. I think also this modality can be helpful for treating those kind of skin type, patients.
Yes, I think there's a slight little limitation because we have a lot of more pigmented populations in our country, and that is a limitation for us.
Mm-hmm.
So yes, we sometimes it's more challenging for us with those people, but if we can get therapy that we can use more in them,
would be definitely better.
Yes, it could be better. So yes, it's a challenge.
Yeah, great. So thank you so much to be with me for this short discussion. But I already learned a lot, and I definitely learned that you are passionate, not only the best player of golf in Cape Town, but and tallest. And I'm also happy to know you. And I would be very happy to see how you continue in your investigation and your scientific approach, and hopefully you'll be still a fan of our technologies, and seeing you again and maybe discuss more insights of your knowledge. Thank you so much, Johann.
Thank you, Peter. I really enjoyed being here and sharing my views with you.
Thank you so
Thanks
much.
a lot.
So please give us the tag and follow us in Instagram, follow us in YouTube, and be tuned for the next episode. And we will be very happy if you like our episodes, and if you maybe share what you like to listen, which question we should ask next time to Johann, and looking forward for the new episode of Ocular Insider. Have a great day.